Hello, my name is Folashade Osibanjo, and I'm a program analyst at NACCHO. This presentation highlights efforts to reach moms who are traditionally classified as hard to reach with breastfeeding support, specifically underserved and at-risk teens. Teen Outreach Pregnancy Services, or TOPS, is a community-based organization in the state of Arizona and a former NACCHO grantee for the CDC-funded Reducing Disparities in Breastfeeding through Peer and Professional Lactation Support Project. Our presenter is Charlotte is a registered nurse and an international board-certified lactation consultant, CAPPA certified lactation educator, and a childbirth educator. She has worked as a nurse educator at TOPS for over 4 years. As the child of a teen parent, Charlotte understands the importance of empowering teens with information to meet their parenting goals and providing support to ensure they have healthy babies. And now you will hear from Charlotte Reed.
Thank you. I'm very happy to be here today sharing our information with you. So a little bit about our organization. We provide pregnancy and parenting education to participants who are under 22 years old. Most of our participants are from low-income and minority households, and they are extremely vulnerable to poor health outcomes. We do provide services to both the teen moms, and we provide services to teen dads as well. During our NACCHO grant, we provided pregnancy, childbirth, and parenting education. We served almost 400 clients during that 18-month period. So with some of our breastfeeding project activities, we wanted to increase the number of our staff with IBCLC certifications. We wanted to provide weekly breastfeeding support groups for our participants. We also wanted to have drop-in lactation support with our IBCLCs. We provided on-call breastfeeding support during the immediate postpartum period, which we found to be a very high need. Part of our goals, too, were to strengthen partnerships with other breastfeeding-related community organizations and to establish a journal review club for our IBCLCs to have continuing education. So some of our successes during this grant were we managed to increase our staff IBCLCs to 4. That was really exciting to cover more breastfeeding support across our state. This is really exciting. We conducted 192 breastfeeding support groups during that time and 491 one-on-one encounters. That was a lot of encounters for the 4 of us. So the other exciting part was that 90% of our clients who completed our classes initiated breastfeeding in the hospital, which is much higher than the average rate for adult women and much, much higher than the teen breastfeeding rate for initiation. So we were very excited about that. So some of the things we wanted to talk about, too, was what is the difference between breastfeeding education with adults versus adolescents? Is it harder to get new moms to breastfeed when they're adolescents versus adults? And are there different barriers that the different groups face? And we did find that a lot of the barriers are the same. We still see some of the very same issues that we would see with adults. With teens, did see some specific challenges that we were able to address. So some of those challenges are probably our biggest challenge would be mixed messages from family, friends, and even healthcare professionals. We found that teens are often uncomfortable standing up for their viewpoints if there's conflicting information or even differing advice from friends, family members, healthcare staff, etc. So some examples of those would be if in the hospital the baby maybe was diagnosed with jaundice and the doctor was recommending supplementation with formula, well, we may have a teen that's very committed to breastfeeding who is afraid to say, can I hand express and supplement with breast milk? They may just go ahead and take the doctor's advice and supplement with formula and sabotaging their own desires to breastfeed to not cause a problem with the doctor who they feel is an authority figure. Other things we've seen in the hospital are, for example, I do visit the girls in the hospital after they deliver, and I will have moms that will be very dedicated to breastfeeding, and I arrive at the hospital to find them formula feeding. So when we ask kind of what's going on, one of the most common responses that we will get from them is the baby was hungry. And so we may ask, well, how do you know the baby was hungry? Well, the baby was crying. So even though we have extensive prenatal education on hunger cues and that crying can be a sign, but that babies do cry and it doesn't always mean they're hungry, they are still overwhelmed and quick to jump to satisfy that need, questioning themselves, was I doing it right? Am I making enough milk? Maybe they know better, and they don't necessarily stand up for what they want to do. Along in the same lines, they're not always comfortable with their own judgment and ability to understand the baby. So, they doubt themselves, they doubt their ability to make milk, and partially because of their age, they think, well, maybe I just can't do this. So part of what we need to do is really reassure these moms to trust themselves, what they've learned, and that they can do this. And we have to create lots of positive messaging. And sometimes we really encourage if the mom is a support person, the teen's mom is a support person, it's great to have them come to class. A lot of things have changed since the teen's mothers have had babies, and they may not be up to date on the most current trends and be giving improper advice to what to do. The other thing kind of along that lines is the teens are more likely to internalize negative messages. If they hear a personal story about something that maybe went wrong or didn't work out so well, they tend to internalize and really latch onto those. For a teen maybe whose sister tried breastfeeding and it didn't work, she may say, well, my sister didn't make enough milk. Well, what she may not be processing is that maybe her sister supplemented with formula from the beginning and therefore had a lower supply and had other things going on. It just wasn't that she could physically not make enough milk. But the teen might remember that and think, well, if my sister didn't, I may not either. Along the same line, some of the other things that we hear is, well, my mom said my brother didn't like breast milk or wouldn't breastfeed. He didn't like the breast. And so rather than thinking that they can do it and they are empowered to do that, they may really internalize that and think, well, my family just wasn't meant to breastfeed. So we really need to strengthen their resolve, to give them good, consistent messages. And we actually, I could think of 2 successes right off the bat that we had along those lines. We had a client who called us one day and said, I just went for my child's 6-month visit. The pediatrician told me that there's no reason to there's no value to breastfeeding beyond 6 months, and told me I should stop breastfeeding. And she's like, but that's not what you taught me. That's not what you taught me. And so with some talking to her, we were able to, resolve that, do you want to breastfeed? What is your choice? And she said yes, and she was able to continue breastfeeding and just let her doctor know that she was going to continue to breastfeed, and that was her choice. Another client shared with us a story about going to a doctor's office, and that the doctor told her that her breast milk was good in the fridge for 3 weeks. She said her brain went crazy inside, remembering back to all of what she had learned with our classes, and thought, that's crazy. If he doesn't know that 3 weeks, what else might he not know? And that client went and found herself a pediatrician who was breastfeeding friendly and supported her efforts. And that was really exciting to see that teen just really advocate for herself. It was really exciting. So the other challenge along we have with teens and social media and friends and family is the teens tend to seek advice first on the internet. So we know that teens are used to the immediate gratification of instant knowledge, of getting information so quickly. They may not wait to call us, text us, use our advice on that. So it's very common to something and then read, not knowing whether they're on a reliable site or if this is good advice. So we try to empower our clients with giving them that, well, if you're going to search breastfeeding issues, here are some really great sites that are reliable and useful that you can use. Another issue we've seen is that they will post something on Facebook, for example. You will quickly read the barrage of answers from their family and friends. So we've seen where a teen will say, maybe be commenting about something and say, I just don't think I'm making enough milk. And then the answers will start popping up, and we'll be like, oh, just give your baby formula. Oh, try this tea, try this herb. Oh, they say if you want to increase your milk supply, of a beer or drink wine. My baby didn't like breast milk. I fed her formula and she's just fine. Don't worry about it. Not everybody can breastfeed. Some babies just don't like to breastfeed. Some women were not made to breastfeed. And so you'll be reading kind of these answers and you'll see kind of their thought process. So we've always encouraged our clients to contact us if they see something that maybe they're not of, And we have had clients who will tag us in an article and say, is this true, or how does this work? Or they'll private message us and ask us questions, or even call or text us with those messages. So those are definitely two of our biggest challenges with teens, which really also can apply to adults as well. So there is some crossover. So our next set of challenges that we are looking at is teens specifically have issues with transportation. A lot of our teens don't have driver's licenses or cars or insurance, even the gas money to get where they need to go, and that can be very difficult for them to come to a breastfeeding group or get into. So we do a lot of online support, phone support, texting, that. The other issue would be school hours. Sometimes they're in school during the day, and we have groups in the afternoon, or they're in school in the afternoon, evening, because they're swapping schedules with somebody else to watch the baby. So you have to be very flexible as far as when you offer services to teens. I'm actually available to our teens via text and Facebook messaging. I try to tell them not to call me too late after 10 or too early, because sometimes they're up in the middle of the night and they think of something and they will shoot a text off. So I try to remember to remind them to be conscious of some of our hours that we keep. So speaking of sleep, that is one of the biggest problems for teens. They love to sleep. We know teens are very sleep-driven, and what we found is it's very common for teens to breastfeed during the day, to bottle feed at night. Sometimes they're pumping, sometimes they're supplementing with formula, but for some reason they really feel that getting a bottle is much easier than breastfeeding during the night. At some times it's having another person provide that bottle so that they can sleep, but if they're pumping, they still have to wake up and pump. But that is just one of the challenges that we see with those teens specifically. We also find that they're unprepared for the lack of sleep. No matter how much you tell them that their sleep will be disrupted, they are still frequently surprised by the lack of sleep and how tired they truly are. When you're tired, as we all know, it's so much easier to give in when something's hard. If you're struggling with latch, it can be much easier to put a bottle in. And so that is definitely a challenge with teens. And also, well-meaning people will suggest, oh, if you feed your baby formula, your baby will sleep longer. Or you need to get your baby on a sleep schedule, and that's so much easier with formula. So we really try to prepare them for that first month for the lack of sleep, promising them that it does get better. The other issue that we have is with teens, you have to be very cautious as far as safe sleep. I know there's some disagreement out there about whether it's appropriate to bed share with a baby, but as far as teens, we have to err on the side of cautions, and we don't recommend bed sharing. We recommend co-sleeping in the same room, but not sharing a bed. It's just something that we feel with teens it's appropriate to make sure that they have those babies sleeping separately. But sometimes they will tuck those babies in with them just so they can get some sleep, so that can be an issue as well. So another issue we have is, one of our challenges is that these girls frequently will report to us they're fearful of people seeing them breastfeed. They feel uncomfortable breastfeeding in public. They may breastfeed at home, but the thought of going to the mall can be very challenging. They fear being confronted or being embarrassed by someone. They also really are fearful of people staring, making them feel uncomfortable. So we find very frequently they feed at home, but will pump and bottle feed or bring formula for when they are out and about. Granted, we do have girls that are champion public breastfeeders, and we encourage them. We let them know the laws, that it's legal and it's safe, and that nobody can ask them to remove themselves or cover. But I think it's still very that feeling of teens that everybody's paying attention to what they are doing specifically. And along those same lines, too, is the sexualization of breasts. We see that a lot of them are very conscious of what the media says is sexy, and we get a lot of fear that if I breastfeed, my breasts are going to be saggy, and they really don't want the saggy breasts. They really don't believe us when we tell them that, pregnancy is what does you in more so, but a lot of them just absolutely refuse to breastfeed because they don't want their breasts to sag. So those are some of our biggest challenges that we see with teens, that may be more so than we see in adults. So what are some of the lessons that we learned? We learned that they need professional and peer support. So within the groups, it was really interesting to watch them when one mom, say, was comfortable breastfeeding in public. And so you'd be sitting in a group, her baby would need to feed, out would come the breast, and she'd pop the baby on and sit there like nothing was going on. And the girls would kind of watch and maybe one would put a cover on, and they kind of watch what the other ones do. So I really encouraged them to support each other and that it's okay to do that. And when they hear things from multiple people, we love when we hear them repeating things that we've taught them, so they get to hear things from multiple sources, because they do need multiple support systems and diverse messaging. So we, as I've said earlier, we use social media. Our staff, we all have a Facebook page, some have Instagram, we have Twitter. It just depends on what your group communicates with. They're private pages. We don't share these publicly. We use Facebook messaging. We use texting. We use the phone. We pretty much, if you can use it, we can use it. I do have student nurses that come in with me, and one of the fun things to do with them is to get them to do some communicating with the teams. The first time I have them communicate with the teams, I have them make a phone call and see how the interaction goes. The second time I have them maybe try Facebook or texting and see how differently they receive information from the teams when using different methods. So it's really important to take each one and communicate the best. We also need that in-person support. So we were also able to provide that drop-in lactation. So when we were in our office, the girls could call or text and say, hey, I need some help, are you in? And if we were available, they were able to drop in. And that is really important, as well as our visits to the hospital. We also do a home visit after they are discharged from the hospital and able to do in-person support as well. We also provide them with lots of resources, breastfeeding hotlines. We can refer them to apps and different websites ourselves. We have lots of information that we can get them to. And again, we talked about those flexible days and times of groups, finding what your group needs to meet and what the most effective time is for them. So the other thing that we learned is support is really needed those first 2 weeks after they get out. And as we all know, those of us who are involved in breastfeeding, those first 2 weeks can be quite intense and demanding, and that's when we see them needing that support. And that's what we do. We are available at those times. We go out and see them. They can call, text, message, and it's really good for them. One of our things that I tell them is, if it feels like your worst day, don't give up that day. Give it one more day. I always just say, just don't give up on when it feels the worst. Just keep trying at least one more time. And we have the girls that do, and we have some girls who just call it quits, and we support them in their efforts as well. So another lesson that we learned is to celebrate success. If you see the T-shirt up in the top, our girls that make 6 months breastfeeding, they get these awesome T-shirts that say, I make milk, what's your superpower? On the left, you'll see our little charms. We had those for 3, 6, 9, 12, 18, 24. We had lots of months. We did some versions where they got the little tokens. We had a volunteer who crocheted or knitted, I'm not sure which, those awesome little booby beanies that you see there. And this is one of our celebrations that we did, and the girls came together and got their shirts and tokens and beanies, and we talked and celebrated and had a great time, and they were so thankful. And if you'll note, the cutest thing ever is those two little babies in the front row were actually holding hands, a little boy and little girl, and they are so cute. We just want to just squish them. So they do need to celebrate successes, and they do need recognition. You know, they may not make it that 6 months, that 12 months that we hope for them to, but if they tried it in the hospital, if they, made it home for the first month, and we just really try to celebrate to get out that positive message. We don't want that negative messaging to get out into the public consciousness that breastfeeding is hard, that teens don't breastfeed. So I always tell these girls to go out and change the world with their opinions and celebration of that. So some of our lessons learned for sustainability. We had really great breastfeeding curriculum. We loved it, and we integrated more. We integrated it into more of our programming so that they get it earlier in pregnancy, that they get it in the parenting, and we really tried to make sure we are using the best evidence-based knowledge that we have out there. We also learned that we need to earmark funds for breastfeeding professional development beyond our IBCLCs. So there are additional staff in our organization that are not IBCLCs, but most of our staff that works directly with clients at least becomes, we do the CAPPA certified lactation educators. Shout out to CAPPA, thank you. And we have all of our staff participates in any breastfeeding training that we do. If you're available and we're doing a webinar, everybody's watching it, from the person who greets people coming in the door to the IBCLC. So we do that. We're also, to keep sustainability, we need to pursue more grants emphasizing breastfeeding. We really enjoyed having the NACCHO grant and what that allowed us to do, and we would love to keep that going, pursuing more grants. So the other thing we had is our participant testimonials. We collected some quotes from our participants, as you can read there. Some of our favorites, we gave someone the confidence to continue past 12 months. Somebody finding out that it was better for the baby helped her decide to breastfeed as long as she could. One mom found it just a great place to meet other moms and continue to get support for breastfeeding. One said she learned a lot about the benefits of breastfeeding and knew she wanted the best for my baby. Another said she came from a family that formula fed all their children, and so this was never something that she really knew about, but through our education she was able to make that decision to start breastfeeding and to get her family to support that decision. And that's really exciting when we hear some of that. And we do tell our participants, because we are focused on breastfeeding education, you know, we don't want to also force it down their throats. We all know that there's issues why maybe somebody chooses not to breastfeed that are very personal and private and may not want to be shared with a group, but we tell the girls that we will support them with their decisions, and as long as they're willing to listen to the education and make the best decision for them. So that's the end of my presentation, and I enjoyed spending this time and sharing TOPS and what we did with our NACCHO grant, with you. So thank you very much.
Thank you for that wonderful presentation, Charlotte. I would like to briefly highlight some of the policy, systems, and environmental changes that TOPS initiated and Charlotte mentioned in order to increase availability of breastfeeding support services for teen moms. An example of a policy change is making breastfeeding support available via social media and updating the breastfeeding curriculum to include a more comprehensive breastfeeding education component. TOPS changed its system by modifying its data collection tools to capture information to a breastfeeding at discharge and doing monthly check-ins. And an example of an environmental change is using the space provided by the hospital as a venue for its pregnancy and childbirth classes. I hope listeners found the information presented by Charlotte useful to your work. If you would like to learn more about TOPS, I encourage you to visit their website. For more information regarding TOPS teen-specific pregnancy and childbirth curriculum, which will soon be published, please contact Laura Peterson at TOPS. And again, I'd like to thank our listeners, and I'd also like to thank Charlotte for this wonderful and very informative presentation. Thank you, Charlotte. Thank you.